The most common one that I think most people are aware of is anorexia nervosa, and anorexia nervosa is, associated with significant restriction, often with then the resultant loss of a significant amount of weight, or being clinically underweight and having, clinical signs of that malnutrition, whether it's amenorrhea in a young woman, or bradycardia, or any of those more severe malnutrition signs. And anorexia may or may not also come with purging. And so I think this is the next one that people always think of as bulimia nervosa, which is often associated with binge eating and then purging, whether that's by laxative abuse or inducing vomiting or some other means of purging. And then binge eating disorder, which is eating a large amount of food in a very short span of time, feeling very out of control during that period of eating and unable to stop past the point of physical discomfort. And then ARFID, which is avoidant restrictive food intake disorder, which is, all the other three that I mentioned often have like body image concerns associated with them, but ARFID is more, there's selective feeding of like restricting certain food groups or restricting certain textures of foods or types of foods based on either a prior trauma, maybe like a choking episode, or maybe some sort of sensory issue, whether the person has autism or some other sort of sensory issue that's affecting their feeding and eating. And so all of these conditions, there's a lot of overlap. And I think, the DSM-5 has like very strict criteria for lumping them into one versus the other. But I think when you ask the difference between disordered eating and an eating disorder, to be diagnosed with an eating disorder by the DSM-5, this is true of any psychiatric condition, there has to be significant impairment in the person's social or physical functioning. Like there's medical complications of that eating pattern, or there's significant social disruption from that. And so you can see how that would become pretty difficult to distinguish because someone who's engaging in disordered eating, which means, there's sort of the spectrum of like what's normal eating, disordered, which is not quite normal, but not severe enough that it's causing problems, and then an eating disorder that meets these clinical criteria. There could be a lot of overlap in how the person looks and the symptoms that you're visibly seeing. And unless you're asking the right questions, you might not be picking up if there's significant impairment. So for example, like chronic dieting or following like whatever the next fad diet is, or intermittent fasting or carnivore, whatever it is, you're restricting calories, you're restricting certain foods, you maybe are skipping meals, or eating a lot at some meals and not a lot at other meals. And there's an intentional manipulation of your eating pattern. And at what point does that cross the line into an eating disorder? And I think if you're not asking the right questions, you might not pick that up.